We hear about all these big, scary health threats all the time, right? But what if I told you there's like this silent epidemic going around, affecting tons of people, maybe even you, and you might not even know just how bad it is?
It's crazy, right? Like,
Yeah.
we're not even talking about some virus or bacteria here. This is about how our bodies are working at a basic level, and it's a huge problem, potentially the vast majority of adults in some places.
That's wild. So today we're diving into insulin resistance. Now, you may not be super familiar with that term, but it could be at the root of so many of the chronic diseases we're dealing with today.
And to guide us through this, we've got Benjamin Bikman's book, Why We Get Sick, The Hidden Epidemic at the Root of Most Chronic Disease, and How to Fight It. It's going to be our map for this deep dive.
Yeah, and I think what's so great about Bigman's work and what we're aiming to do today is take all this complex info and break it down for you to give you those light bulb moments and show you why this matters so much for your health. This is not just another health fad, right?
No way. This is about the core of your metabolic health. Insulin resistance has these ripple effects that touch pretty much every aspect of your well-being.
So let's get right to it. What exactly is insulin resistance? Like, if you had to explain it, simply what's happening in the body.
Basically, insulin resistance is when your body's cells aren't listening to insulin as well as they should.
Yeah.
Insulin's that hormone that helps get glucose, which is blood sugar, into your cells for energy, right? Well, with insulin resistance, those cells become less responsive to insulin's signal.
And it's way more common than people realize. I was actually shocked by the numbers.
It is pretty crazy.
Yeah.
Studies suggest that up to 88% of adults in the U.S. could have some degree of insulin resistance. But it's a global issue. We see it in Mexico, China, India, Europe, Canada, the Pacific Islands, North Africa, the Middle East. It's everywhere.
You know what I find interesting is that for so long, the conversation around diabetes has been so focused on glucose. Why do you think insulin has been kind of overshadowed?
It's a good question. For decades, we've been obsessed with monitoring and managing blood sugar levels. And while glucose is definitely a marker, the real issue in type 2 diabetes, which is closely tied to insulin resistance, is that you actually have too much insulin, not too little, like in type 1.
So it's like your body's pumping out insulin, but it's not working effectively because the cells are resistant to it.
Exactly. And historically, even though we could measure insulin levels, the way we diagnose and monitor diabetes has been very glucose-centric. So insulin's role, especially in the early stages of insulin resistance and type 2 diabetes, has often been missed. We were so stuck in this framework of diabetes being a glucose problem.
And it's interesting how the same glucose-based criteria are used to diagnose both type 1 and type 2, even though the underlying cause is too little versus too much. But ineffective insulin are completely different.
Right. It really highlights the historical focus on glucose. High glucose is the common symptom, but type 1 and type 2 are fundamentally very different conditions. And this glucose-centric view has, in a way, pushed the importance of insulin resistance into the background.
Now, insulin resistance on its own isn't immediately life-threatening, but it's like laying the groundwork for so many other serious conditions. Let's start with how it affects our heart health.
So if you think about it, the link between high insulin levels, which are typical in insulin resistance, and high blood pressure makes a lot of sense. High insulin directly causes your body to hold on to more salt and water. That extra fluid increases your blood volume, and bam, higher blood pressure.
And isn't it fascinating how carbs, which have a bigger impact on insulin than fats do, are also more strongly linked to increased blood pressure?
Right. Dietary fat doesn't have that same effect on insulin, so it doesn't tend to raise blood pressure in the same way. High insulin also contributes to hypertension by thickening the walls of your blood vessels. Insulin's a growth-promoting hormone, so when there's too much of it, it tells the cells lining your blood vessels, the endothelial cells, to grow and thicken. This narrows the vessels and increases resistance to blood flow.
Now let's talk about cholesterol and triglycerides. We often hear about LDL cholesterol being the bad guy. How does insulin resistance change that picture?
Well, what's interesting is that while high LDL has been the focus for so long, more research is suggesting it might not be inherently bad. The real trouble often starts when these fats and cholesterol become damaged through oxidation, and this process is accelerated by high levels of oxidative stress in the body.
And this damage is what leads to those nasty foam cells forming in our arteries, right?
Yep. White blood cells called macrophages come along and try to clean up these damaged lipids,
Yeah.
but when they get overloaded, they turn into foam cells. These foam cells then trigger inflammation, which attracts more macrophages, and eventually you get this buildup of plaque in your arteries. Insulin resistance plays a big role here because it tends to increase what's called LDL pattern B, which are smaller, denser LDL particles that are more prone to damage and causing problems in the arteries. And it also increases overall oxidative stress in the body.
So it's not just about how much LDL you have, but the type and how susceptible it is to damage. What about the direct effects of insulin resistance on the heart muscle itself, like in conditions like cardiomyopathy?
Well, the heart muscle mainly uses glucose for energy. In dilated cardiomyopathy, or DCM, the heart muscle becomes stretched and thin, making it weaker at pumping blood. As the heart struggles, it actually needs more glucose to function. But insulin resistance makes it harder for the heart to get that glucose. So you have this mismatch between the heart's energy needs and its ability to use fuel, which contributes to the weakening and dilation.
Wow, it's like a domino effect. Now let's switch gears and talk about the brain. It wasn't too long ago that we thought insulin had no role to play there. What's changed?
It's amazing how much our understanding has evolved in recent years. We now know that the brain has insulin receptors, and that insulin regulates a bunch of vital brain processes. It helps brain cells take up glucose for fuel, supports their growth and survival, and even plays a role in appetite control. When your brain senses rising insulin levels, it signals that you're full.
So what happens when the brain becomes insulin resistant?
Well, think of it this way. Insulin resistance in the brain is like starving your brain of what it needs to function properly, even though there's plenty of fuel around. This can lead to problems with memory learning and even accelerate brain aging. It disrupts all those crucial functions we talked about. It can lead to overeating because the signals that tell you you're full aren't working as well. It can mess with short-term learning and even damage long-term memory. And what's really interesting is that long-term insulin resistance can actually change the physical structure of the brain, making it look older than it is.
And the implications for serious neurological diseases like Alzheimer's are becoming more and more apparent.
Yeah, there's this growing recognition of the role of insulin resistance in Alzheimer's disease. Some even call it type 3 diabetes. At first, the link was thought to be due to the sedentary lifestyles that are often seen in people with Alzheimer's. But research showed that even in the early stages, Alzheimer's patients were more insulin resistant than healthy individuals with similar activity levels.
So it's not just a consequence of the disease, but potentially a contributing factor.
The evidence is definitely pointing in that direction.
Yeah.
And the impact of insulin resistance on blood vessels also links it to vascular dementia, which is the second most common type of dementia. You see, since insulin resistance affects how well your blood vessels function, it increases the risk of not getting enough blood flow to the brain, which can lead to vascular dementia. Studies have found a significantly higher risk of developing vascular dementia in people with insulin resistance.
That's scary. So we're seeing that a healthy brain needs healthy insulin sensitivity for a whole range of functions, not just for fuel. Now let's explore a connection that might seem a little less obvious at first, how insulin resistance affects reproductive health.
This is one that always surprises people. You wouldn't necessarily think of insulin as being involved in reproduction, but it's absolutely essential for things to work properly. It seems to act as this metabolic safety signal, telling the brain whether the environment is good enough to support reproduction.
So too little insulin is a problem, but so is too much.
It's exactly. Research suggests that both insufficient and excessive insulin, like we see in insulin resistance, can negatively impact reproductive processes. Insulin-resistant men and women are more likely to have trouble conceiving. And during pregnancy, insulin resistance can contribute to complications like preeclampsia, which is a serious condition involving high blood pressure and reduced blood flow to the placenta. The placenta actually tries to compensate for this by releasing VEGF, which is a substance the body uses to try and grow new blood vessels.
It's incredible how interconnected everything is, and it even affects the baby's birth weight and potentially their health later in life.
Yeah, there's a pretty remarkable link between a mother's insulin resistance and babies being born outside the normal weight range. The Dutch famine studies showed this really clearly. Babies born to mothers who experienced famine early in pregnancy were more prone to obesity later in life, and it wasn't just about their birth weight. Interestingly, low birth weight babies who are often born to mothers with preeclampsia also have a higher risk of developing obesity and metabolic disorders later in life, even more so than high birth weight babies.
It's mind-blowing how these things play out over a lifetime. Or polycystic ovarian syndrome, which is a major cause of infertility in women.
PCOS is fundamentally a disease of too much insulin. The ovaries develop cysts, which can cause pain, and the ovaries themselves can become enlarged. And it throws off the whole delicate hormonal balance needed for normal ovulation. Insulin messes with an enzyme called aromatase, which converts androgens into estrogens. This leads to lower estrogen and higher androgen levels, and insulin may even directly block the release of luteinizing hormone, or LH, further disrupting fertility.
And we see these hormonal imbalances play out in a number of ways, right?
Yeah, the higher androgen levels can cause increased facial and body hair in women and even male pattern hair thinning. And high insulin itself can cause those dark patches on the skin called acanthosis nigricans. In men with insulin resistance, there's an increased risk of erectile dysfunction. And even the timing of puberty can be influenced by insulin levels. Overnutrition and high body fat, which are driven by insulin, can lead to earlier puberty, especially in girls, because of increased leptin production.
It's really a web of interconnected systems. Now let's move on to a topic that I think causes a lot of anxiety for people, cancer. We often think of genetics as the main factor, but how does insulin resistance fit into the picture?
Well, there's this emerging perspective that cancer might actually be more of a metabolic disease than purely a genetic one. Whatever triggers it, cancer is all about cells growing out of control. And insulin resistance helps create the perfect environment for this to happen.
How so?
With insulin resistance, you have both high glucose and high insulin in the blood. Cancer cells love glucose. They need it to grow. And high insulin acts as this powerful growth signal, especially if those cancer cells become even more sensitive to insulin than normal cells. There's also this protein called insulin-like growth factor 1, or IGF-1, which is similar to insulin in its growth-promoting effects, and it's often elevated in various cancers.
And the data linking high insulin levels to increased cancer risk is pretty scary.
Yeah, it is. People with hyperinsulinemia have roughly double the risk of dying from cancer, with the strongest links being to breast, prostate, and colorectal cancers. And specifically in breast cancer, the tumors often have way more insulin receptors than healthy breast tissue, making them even more responsive to insulin's growth signals. High insulin can also increase the growth of cells in the lining of the intestines, which could play a role in cancer development there. Now, while we can't control everything when it comes to cancer risk, it's empowering to know that insulin resistance is something we can definitely influence.
That's so important. Now let's consider the less dramatic but still very real effects of insulin resistance on aging our skin, muscles, and bones. It's interesting to think that some of those things we just accept as inevitable parts of getting older might actually be tied to underlying metabolic issues, especially insulin resistance.
Take hearing loss, for example. Presbycusis, which is the age-related hearing loss that's so common, is significantly worse in people with insulin resistance, even after you account for their age and weight. They tend to have more trouble hearing lower-pitched sounds.
And it's not just hearing loss, there are other ear-related problems too, right?
Yeah, conditions like Meniere's disease, which involves vertigo, tinnitus, and hearing loss, are also linked to insulin resistance. Studies have shown that a high percentage of people with Meniere's and tinnitus also have hyperinsulinemia. One ear, nose, and throat specialist even went so far as to say that problems with how the body handles glucose are the most common but often overlooked cause of vertigo.
Let's move on to muscle health, which is so crucial for our overall metabolic function.
Absolutely. Muscle is actually the biggest insulin-sensitive tissue in your body. It's where a lot of the action happens when it comes to insulin. And insulin is really important for muscle growth and repair and for how your body processes protein. The more muscle you have and the more sensitive it is to insulin, the better off you are metabolically. But in insulin resistance, muscle becomes less responsive to insulin, making it harder to take up glucose and potentially leading to muscle loss and weakness.
And this is what contributes to sarcopenia, that age-related loss of muscle mass.
Exactly. Insulin resistance makes it harder for insulin to do its job of building and protecting muscle. Normally, insulin helps stimulate muscle protein synthesis and prevents breakdown. But when muscle becomes resistant, that signal is weakened. And even conditions that seem unrelated, like fibromyalgia, which is a common pain disorder, are now being linked to insulin resistance.
It's fascinating. And what about joint health and skin?
Well, high insulin levels can trigger inflammation in the joints and actually reduce the production of synovial fluid, which is that lubricating fluid that keeps our joints moving smoothly. This can contribute to osteoarthritis. It's worth noting that rheumatoid arthritis, which is an inflammatory condition, can actually increase the risk of developing insulin resistance. As for the skin, those dark patches we talked about, acanthosis nigricans, are often a visible sign of high insulin levels.
It's amazing how many seemingly separate conditions can be tied back to this one underlying issue. Let's move on to our gastrointestinal system and kidney health. How does insulin resistance affect these areas?
Both digestion and waste removal are essential processes, and they're both affected by insulin resistance. For instance, acid reflux or reflux esophagitis can be exacerbated by insulin resistance because it can impair the function of the lower esophageal sphincter, which is supposed to keep stomach acid from splashing up into the esophagus. This can lead to Barrett's esophagus and increase the risk of esophageal cancer.
And the liver, which plays such a key role in regulating glucose, is also affected.
Oh, absolutely. The liver's job is to store glucose as glycogen and release it when needed. In insulin resistance, the liver becomes less responsive to insulin signals. It may keep releasing glucose even when insulin levels are high, which contributes to higher blood sugar and increased fat production in the liver. This can lead to non-alcoholic fatty liver disease, or NAFLD. And consuming a lot of fructose is a really big contributor to NAFLD because of how the liver processes it.
What about the gallbladder and the kidneys?
Well, insulin actually slows down the movement of the gallbladder, which can increase the risk of gallstones, which is the opposite of what happens when you consume enough dietary fat. The kidneys are more than just filters. They also regulate blood volume, bone health, and pH balance. High insulin levels can lead to increased parathyroid hormone and blood calcium, as well as changes in urine pH, both of which can contribute to the formation of kidney stones. So insulin resistance disrupts this delicate balance of so many interconnected systems in the body. Now let's tackle a question that's been debated for a long time, the relationship between insulin resistance and obesity. It's a bit of a chicken or the egg situation, right? Yeah, it really is. We've known for about a century that obesity and insulin resistance often go hand in hand. The traditional view, and still the most common one, is that obesity causes insulin resistance. The idea is that having too much body fat somehow interferes with the body's ability to use insulin properly. And it's true that losing weight often does improve insulin sensitivity.
But there's also evidence that insulin resistance might come first and actually drive weight gain.
Right. That's where it gets really interesting. Some studies suggest that insulin resistance might actually precede and contribute to weight gain. For instance, studies in children have shown that those with higher insulin levels were more likely to gain more weight over time, regardless of their initial weight. And similar findings, though more complex, have been seen in adults, where lower insulin levels are often associated with slower weight gain.
So insulin itself might be the main driver of fat storage, regardless of how many calories you're taking in.
That's what the research suggests. Back in the 1920s, a doctor named Wilhelm Folta actually highlighted the importance of pancreatic hormones, especially insulin in fat accumulation. While the idea of calories in, calories out became dominant, the evidence points to insulin being the primary hormone that regulates how your body stores fat. When insulin levels are high, your body gets the signal to store more energy as fat, even if your calorie intake hasn't changed.
That's a huge paradigm shift. Now that we understand what insulin resistance is and how far-reaching its effects are, let's talk about what causes it. Are there things like age and genetics that we just can't avoid?
There are definitely some factors that are out of our control. Our insulin sensitivity naturally declines as we get older, and genetics do play a role, although maybe not as big a role as some people think. Some populations, like the Pima Native Americans, have a much higher predisposition to insulin resistance, and this could be due to something called the thrifty genotype theory, which suggests that their genes evolved to store energy very efficiently during times of famine.
But our environment and lifestyle seem to play a huge role, too.
Absolutely. There's this other theory called the diet adaptation theory, which suggests that the widespread adoption of the Western diet, which is loaded with refined carbs and processed foods, is a major culprit in the insulin resistance epidemic we're seeing today. And we see this play out when people move from more traditional environments and adopt Western lifestyles. Their rates of insulin resistance go up, and then there are the hormonal changes that come with aging. The decline in estrogen during menopause can increase insulin resistance in women, and similarly, lower testosterone levels in aging men are also linked to reduced insulin sensitivity.
We've talked about too little insulin being a problem and insulin resistance, which is kind of like too much insulin, but it's not effective. But can having too much insulin actually cause insulin resistance?
It seems counterintuitive, but yes, chronically high insulin levels are a major driver of insulin resistance. It's like this: if you keep hitting a system with the same signal over and over again, it's going to start becoming less responsive to protect itself. For every small increase in your fasting blood insulin, there's a potential for a significant increase in insulin resistance.
What about stress? We all know that stress wreaks havoc on our bodies.
Yeah, stress hormones like epinephrine and cortisol have a rapid and pretty dramatic negative impact on insulin sensitivity. Cortisol in particular tells your liver to make more glucose, and it directly causes insulin resistance in muscle tissue. This ensures that there's plenty of readily available energy to deal with whatever stressor your body thinks it's facing.
And thyroid hormone also comes into play.
Yes, thyroid hormone is crucial for maintaining normal insulin signaling. And interestingly, the more body fat someone has, the less responsive they tend to be to thyroid hormone, a condition called thyroid resistance. And on the flip side, Having an underactive thyroid or hypothyroidism is associated with reduced insulin sensitivity because cells actually have fewer insulin receptors.
Let's talk about fat tissue itself. We often think of fat as just this inert storage depot, but it's much more active than that, right? And the location of the fat matters too.
You got it. Visceral fat, which is the fat that's stored around your internal organs, is much more strongly linked to insulin resistance than subcutaneous fat, which is the fat just under your skin. Studies in animals have shown this really clearly. And even people who look lean can be insulin resistant if they have a lot of visceral fat. Insulin's job is to tell fat cells to store fat, both by taking it in and by making new fat. It also prevents the breakdown of fat. In insulin resistance, those larger fat cells, which have fewer insulin receptors for their size, become less responsive to insulin signals.
And these fat cells can actually produce harmful molecules that make insulin resistance even worse.
Yeah, molecules like 4-hydroxynonenal or 4-HNE, which is formed from omega-6 fats and oxidative stress, and is super common in Western diets, and ceramide 1-phosphate or C1P, which is linked to inflammation, can disrupt how fat cells function and contribute to them getting bigger, which further increases insulin resistance. And in general, ceramides can interfere with insulin function in a bunch of different tissues. The buildup of fat in the liver, which can be caused by things like fructose alcohol and high insulin itself, leads to insulin resistance in the liver and creates this vicious cycle of even higher insulin levels. And what's interesting is that muscle tissue can actually become insulin resistant on its own from prolonged exposure to high insulin levels, even without any changes in fat tissue.
So too much fat is a problem, but so is too little.
Yeah, might sound strange, but yeah. There's a condition called lipodystrophy, where people lack subcutaneous fat, and this actually leads to severe insulin resistance. Because the body still needs to store fat, it ends up depositing it in other places like the muscles and the liver, which leads to what's called ectopic fat accumulation, and this causes severe insulin resistance.
Inflammation seems to be this common thread in so many of these chronic diseases. How does it contribute to insulin resistance?
Inflammation is a huge driver of insulin resistance in a lot of different conditions. When visceral fat builds up, it attracts immune cells called macrophages, which become those foam cells we talked about and release inflammatory proteins. And then you have inflammatory autoimmune diseases like rheumatoid arthritis, lupus, and Crohn's disease, which have a strong connection to insulin resistance. Even acute infections can cause temporary insulin resistance. There's also a two-way link between gum disease and insulin resistance. Environmental toxins like those found in cigarette smoke also increase inflammation and insulin resistance, and even secondhand smoke is harmful. Asthma also has a high association with insulin resistance, likely because of chronic inflammation from inhaling irritants.
And of course, our diet plays a massive role in inflammation and how sensitive we are to insulin.
You said it, monosodium glutamate, or MSG, which is a flavor enhancer, has been shown to induce obesity and increase insulin resistance in lab animals. Fructose, whether you get it directly or as part of table sugar, increases insulin resistance by messing with body fat and causing inflammation. And even artificial sweeteners, though they're low in calories, have been linked in some studies to an increased risk of metabolic syndrome and type 2 diabetes. This could be because they might increase cravings or maybe cause small spikes in insulin. Lipopolysaccharide, or LPS, which is this nasty toxin produced by bacteria in the gut, can leak into the bloodstream if you have a leaky gut, and this can cause inflammation and insulin resistance. Interestingly, LDL cholesterol might actually play a protective role here by helping to neutralize LPS. And then there are lifestyle factors like sleep and movement, which are also super important, right? Getting too little sleep, even for just a week, can significantly increase insulin resistance. And some recent studies even suggest that as little as 2 days of sleep restriction can have an impact. On the other hand, exercise is one of the best things you can do to improve insulin resistance. When you're physically active, your muscles can actually take up glucose from the blood without needing insulin. It's an insulin-independent process. And exercise also improves insulin sensitivity by helping with central obesity, oxidative stress, inflammation, and sleep quality. Resistance training might be especially beneficial minute for minute because it helps build muscle mass. And the intensity of your exercise really matters. More vigorous activity leads to greater improvements.
And then there's this unexpected factor, temperature.
I know, right?
Yeah.
Exposing yourself to cold can actually improve insulin sensitivity. We have this type of fat called brown adipose tissue, or BA, which burns calories to generate heat. When BD is activated by cold, it has a super high metabolic rate and uses a lot of glucose, similar to muscle tissue.
Wow, this has been a really comprehensive look at the causes of insulin resistance. Now the big question, how do we fight back and improve our insulin sensitivity?
When we look back at history, the way we view food and nutrition has been shaped by a lot of different things. The move away from dietary fat, which was based on some pretty controversial science, led to an increase in carbohydrate consumption. And many believe this has contributed to the rise in insulin resistance. And there's this ongoing debate about whether it's the total number of calories we eat or the types of calories that really matter.
So let's start with what we should be eating. What are the most effective dietary strategies?
While severe calorie restriction can actually backfire because it can lead to the release of stress hormones like cortisol and a decrease in thyroid function, both of which can worsen insulin resistance. Mild calorie restriction can help, but the effects might not be super dramatic on their own. One thing that can help is eating your carbohydrates last after your protein and veggies. This helps minimize the spike in glucose and insulin. Dietary fiber is generally beneficial, especially if you're eating more carbs. When it comes to meal frequency, eating more often is probably not the best for insulin control. Intermittent fasting or time-restricted eating gives your body a break from constantly having to deal with insulin. It's also important to remember that hunger isn't just about your stomach feeling full, it's about your cells needing energy. And fat is much better at satisfying that need than carbs. And interestingly, your body's insulin response to glucose is actually highest in the morning because of all the other hormones that are circulating. So what you eat for breakfast, or whether you eat breakfast at all, might matter more than we think.
And a big focus needs to be on reducing carbs, right?
That's exactly. Since excess insulin is a major culprit in insulin resistance, lowering your intake of carbs, which have the biggest impact on your blood sugar and insulin levels, is a key strategy for improving insulin sensitivity. It helps your body reset and become more responsive to insulin again. Protein has a much milder effect on insulin, and fat has very little impact. And, our modern shift towards eating more carbs and less fat hasn't really paid off in terms of health improvements. Studies show that low-carb diets can significantly reduce insulin levels and improve markers of insulin sensitivity, and often people can reduce or even eliminate their need for diabetes medication. Paying attention to the glycemic load, or GL, of foods, which is a measure of how much they raise your blood sugar, and choosing lower GL options like non-starchy vegetables, fatty fruits, and lean proteins is also really important. Low-carb diets are especially helpful for people who don't process glucose very well. And then there are very low-carb, high-fat ketogenic diets, which force your body to produce ketones. These ketones can be used as an alternative fuel source and have been shown to have benefits for things like mitochondrial function, oxidative stress, and inflammation. Even taking ketone supplements has shown some early promise for improving glucose control without raising insulin levels. And what's really interesting is that eating a low-carb diet without restricting calories can sometimes lead to more fat loss and even an increase in metabolic rate compared to restricting calories on a low-fat diet, especially for people who are more insulin resistant to begin with. And beyond just addressing insulin resistance, controlling carbs has shown benefits for blood cholesterol levels by improving the size of LDL particles, blood pressure, reproductive health like in PCOS, neurological symptoms in older adults, cognitive function in Alzheimer's and mild cognitive impairment, and even Parkinson's disease symptoms.
So much good stuff there. Now, what about things we can do beyond diet? Are there medications or surgical options to consider?
There are a number of medications that can help improve insulin sensitivity. Metformin TZDs, SGLT2 inhibitors, they all work in different ways. And aspirin, with its anti-inflammatory effects, might also be beneficial. And then there's bariatric surgery. Gastric bypass in particular has been shown to have really impressive and rapid effects on insulin sensitivity, often even before significant weight loss occurs, which further emphasizes that body fat and insulin resistance aren't always directly linked. Sleeve gastrectomy is similar to gastric bypass in terms of its effects on insulin sensitivity. Gastric banding tends to have the smallest impact.
This is a lot of information. How can people listening start putting all this into practice and figure out where they stand?
Well, the first step is to get a sense of your starting point. There are insulin resistance quizzes out there that can give you a general idea of your risk. But for a more accurate assessment, the best thing is to have your fasting insulin levels measured. If your levels are below about 6 cml or 41 pml, that's generally considered healthy. If they're moderately elevated, somewhere between 7 and 17 EML or 48 and 118 PML, that's a good sign that it's time to start making some changes, especially with your diet and when you eat. And if your levels are higher than that, it really signals a need for more significant lifestyle adjustments. When it comes to exercise ramping up, the intensity is key both for aerobic exercise like interval training and for resistance training, really pushing yourself to get those insulin sensitizing benefits. That increased intensity actually makes the two types of exercise more similar in their effects. But perhaps the most important lifestyle change of all is to eat in a way that keeps your insulin levels low. This involves 4 key principles. Eat fewer carbs. Prioritize protein, include healthy fats in your diet, and be strategic about when you eat. The ideal balance of protein, fats, and carbs will vary from person to person, but carbs will likely be significantly lower than what most people are used to on a typical Western diet. Learning about the glycemic load of different foods and choosing lower GL options is really helpful. And be mindful of artificial sweeteners. Fermented foods can be beneficial for insulin sensitivity. While you can control insulin levels on different types of diets, including animal products, can make it a bit easier because they're naturally higher in protein and lower in carbs. If you're vegetarian or vegan, you'll want to focus on non-starchy, higher-fat plant foods and choose natural fats over processed ones. When it comes to micronutrients, magnesium and vitamin D seem to be important for insulin sensitivity. Some simple things you can start doing right away are switching up your breakfast to prioritize fats and proteins, or even skipping breakfast altogether. And of course, get your fasting insulin levels checked.
This has been such an incredible deep dive. It's clear that insulin resistance is this widespread problem with serious implications for our health.
And the takeaway here is that so many of the chronic diseases that we're struggling with may actually share a common origin in insulin resistance.
The good news is that we can do something about it.
That's the empowering part. Lifestyle changes, especially in what we eat and how we move, can dramatically reduce our risk and even help reverse insulin resistance.
So as you think about your own health, remember that your individual lifestyle, your genetics, your unique circumstances, they've all contributed to where you are today. But understanding insulin resistance gives you the power to take control and start making positive changes.
It really comes down to this: what's one small step you can take today to start fighting the resistance and taking charge of your metabolic health?